I want you to think about something for a moment. You've been careful about your health. You eat your vegetables. You follow the advice you've been given for decades. And yet, something still feels off. Maybe it's the shortness of breath that showed up in the last couple of years. The cough that lingers a little longer than it should. The feeling that your lungs just aren't working the way they used to. You blamed aging, maybe allergies, maybe the weather. But what if I told you that the damage might be coming from something sitting in your vegetable drawer right now? Not from cigarettes, not from pollution, not from anything you'd expect. From specific vegetables. Vegetables that are universally praised as healthy, that, in certain forms and combinations, trigger a slow inflammatory response deep inside the lungs that most people over 60 never connect to their diet. Stay with me, because what I'm about to share is not something that comes up in a routine checkup, but it absolutely should. Most people over 60 believe this. The more vegetables you eat, the healthier your lungs. Full stop, no exceptions. I believed that too, early in my career. But after more than 20 years working specifically with older adults, reviewing their diets, their symptoms, their lab work, I started noticing a pattern I couldn't ignore. Patients with persistent respiratory inflammation. Patients with unexplained breathlessness. Patients whose lung function was declining faster than their age alone could explain. And in many of those cases, when I looked closely at what they were eating, the same vegetables kept appearing. Not junk food, not processed food. Vegetables, ones they were eating specifically because they thought it was protecting them. That disconnect between intention and outcome is exactly what I want to address today. My name is Dr. Ben Bates. I've spent over 20 years in preventive medicine, focused on aging and longevity in adults over 60. I've worked alongside pulmonologists, immunologists, and cardiologists. I've sat with patients who were doing everything by the book and still experiencing symptoms nobody could fully explain. I'm not here to tell you vegetables are bad. I'm here to tell you that after 60, the body processes certain compounds in vegetables very differently than it did at 40. And for your lungs specifically, that difference matters in ways most people are never told about. Let's get into it. Now, the fourth vegetable on this list is the one that shocks people most. It's one of the most celebrated health foods in America, and it carries a specific risk for lung tissue after 60 that almost nobody is talking about. You'll want to stay for that one. The first vegetable I want to talk about is one that's been recommended for lung health for years. Spinach, raw spinach, spinach smoothies, spinach salads every day. I've had patients tell me their doctor specifically suggested eating more spinach for inflammation. And here's the problem. Spinach is extraordinarily high in a compound called oxalate. Oxalate is a naturally occurring acid found in many plants. In small amounts, in a young, well-functioning body, it's largely handled without issue. But here's what changes after 60. The kidneys, which are responsible for filtering oxalate out of the blood, become less efficient with age. When oxalate isn't cleared quickly enough, it accumulates in the bloodstream. And here's what most people never hear. Oxalate crystals don't just collect in the kidneys. They deposit in soft tissue throughout the body, including the delicate tissue lining the airways and lungs. When oxalate crystals accumulate in lung tissue, they trigger a localized inflammatory response. The airways become irritated. Mucus production increases. Breathing becomes subtly harder, in a way that creeps up so slowly most people assume it's just getting older. I had a patient I'll call Gloria, 71 years old, former kindergarten teacher, active woman. She had been drinking a large raw spinach smoothie every morning for 3 years because a health article told her to. She came to me with persistent dry cough, mild breathlessness climbing stairs, and a feeling she described as like there's always a little pressure in my chest. Her chest x-ray was unremarkable. Her doctor had attributed it to age. When I looked at her diet and her oxalate intake, the picture became much clearer. We reduced her raw spinach significantly. We switched her to lightly steamed spinach a few times a week because cooking reduces oxalate content by up to 30 to 40%, and rotated in lower oxalate greens like romaine and arugula. Within 6 weeks, her morning cough had nearly disappeared. The chest pressure she'd lived with for 2 years was gone by week 8. She looked at me at her follow-up and said, "I thought I was doing the right thing." She was trying to. The information just wasn't complete. The fix. Don't eliminate spinach. Rotate it. Eat it cooked, not raw in large quantities. And never make it a daily staple in high amounts after 60. Now, before the second vegetable, I want you to do something. Think about your breathing right now. Take a slow breath in. Does it feel completely effortless? Or is there a subtle tightness, a slight resistance you've learned to ignore? If you recognize something just now, keep listening, because what comes next may explain it. The second vegetable is one that almost everyone over 60 has been told to eat more of. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, cabbage. These are held up as cancer-fighting, anti-inflammatory superfoods. And there is real science behind those benefits. But here's what that conversation almost never includes. Cruciferous vegetables contain compounds called goitrogens and a sulfur-based compound called sulforaphane. Both are genuinely protective in moderate amounts. But in large quantities, especially in people over 60 with any underlying thyroid issues, which are far more common than most people realize, these compounds interfere with iodine absorption. And here's the connection to the lungs that almost nobody makes. The thyroid gland regulates the rate of fluid clearance in the lungs. It influences mucus production and the health of the respiratory epithelium, the thin layer of cells that lines your airways. When thyroid function is suppressed, even subtly, even without a formal diagnosis, mucus clearance slows, airways become sluggish, the lungs become more susceptible to infection and inflammation. I want to be precise here. One serving of broccoli 3 times a week is not a problem for most people. But I've had patients eating massive daily portions, cruciferous vegetables at every meal because someone told them it was the key to health, and experiencing gradual, unexplained respiratory changes that reversed when they moderated their intake and started rotating more variety into their diet. Ask yourself honestly, how much broccoli, cauliflower, or cabbage are you eating per week? If the answer is every single day, your respiratory system may be paying a quiet price. The fix: limit cruciferous vegetables to 3 or 4 servings per week. Always cook them rather than eating them raw in large amounts. Cooking breaks down a significant portion of the problematic compounds. And rotate. Don't build your diet around any single vegetable family. Let me tell you about a patient I'll call Harold, 68 years old, retired engineer, methodical man. He had read extensively about anti-cancer diets and had decided that cruciferous vegetables were his primary defense. He was eating some form of broccoli, cauliflower, or Brussels sprouts at lunch and dinner every single day. He came to me because his voice had become slightly hoarse. He was waking up with mucus in his throat most mornings, and he felt like he couldn't take a fully satisfying deep breath. His pulmonologist found no structural cause. His cardiologist cleared him completely. But his thyroid function, when tested carefully, was at the low end of normal. Not diagnosable as a condition, but functionally suppressed. We worked with his diet. He kept cruciferous vegetables, but reduced to 4 servings per week, always cooked, never raw. We added more iodine-rich foods and rotated in different vegetable families. 3 months later, the morning mucus was gone. His voice had fully cleared, and he told me he was breathing better than he had in 2 years. I never would have guessed, he said. I thought more vegetables meant more protection. Sometimes more is not more, or is. After 60, balance is everything. Now we're getting to the 2 that surprise people most. And I want to say something before we continue. If you're finding this useful, if something I've said has made you think about your own breathing differently, subscribe to this channel right now. Because what I share here is the kind of conversation that should happen in every doctor's office. It just rarely does. The third vegetable is one with an almost mythical reputation for health. Tomatoes. I know, tomatoes are technically a fruit, but they're consumed as a vegetable, and most people over 60 eat them daily. Tomatoes are genuinely rich in lycopene, which is a powerful antioxidant. That's real. I'm not disputing that. But tomatoes also belong to the nightshade family. And here's what most people over 60 are never told about nightshades. They contain compounds called alkaloids, specifically solanine and tomatine, that in sensitive individuals trigger an immune response in the mucous membranes. After 60, as immune regulation becomes less precise, nightshade sensitivity becomes more common. The immune response triggered in the mucous membranes doesn't always announce itself dramatically. It doesn't cause an obvious allergic reaction. Instead, it creates a slow, low-grade inflammatory state in the tissue lining the respiratory tract. The airway lining becomes slightly thickened, more reactive to dust, cold air, and seasonal changes. Coughing becomes more frequent. Breathing feels slightly congested, even without a cold. And because tomatoes appear in almost every meal, pasta sauce, salads, sandwiches, soups, the exposure is constant. The inflammation never fully resolves, and the connection is almost never made. I want to ask you directly, do you feel more congested or cough more in the hours after a heavy tomato-based meal? Think carefully, because that pattern, dismissed as coincidence, might be telling you something important. The fix: you don't need to eliminate tomatoes, but if you experience persistent respiratory congestion or chronic cough, try removing nightshades completely for 3 weeks and observe what changes. Many patients are genuinely surprised by what they discover. Also, cooked tomatoes with olive oil are significantly better processed by the body than raw tomatoes in large amounts. The cooking changes the structure of the alkaloids and increases the bioavailability of the protective lycopene at the same time. It's not about avoiding tomatoes. It's about how and how much. And now the fourth vegetable. This is the one I said would surprise you most. And I mean it. Because this one is not just celebrated as healthy, it is specifically recommended for respiratory health. Garlic. I can already hear the resistance. Dr. Bates, garlic is antibacterial. Garlic protects the lungs. And you're right. In moderate amounts, garlic has real antimicrobial properties. But here's what happens when garlic is consumed in large quantities, or in concentrated supplement form. In people over 60 with any blood-thinning medication or aspirin use, garlic contains compounds called allicin and ajoine that have significant blood-thinning effects. When combined with common medications taken by the majority of people over 60, blood thinners, aspirin, even certain blood pressure medications, the thinning effect compounds. And here's the specific respiratory connection. When blood becomes significantly thinner than normal, the tiny capillaries in the lung tissue, the microscopic blood vessels that deliver oxygen to the alveoli, the small air sacs where oxygen enters the bloodstream, become more prone to microbleeds. Small, invisible, painless individually. But repeated microbleeds in lung tissue over time trigger a localized inflammatory healing response. The tissue becomes progressively more scarred and less elastic. Breathing capacity decreases. Oxygen exchange becomes less efficient, and the person feels it as gradual, unexplained breathlessness, attributed to age. When attributed to age, nothing changes. When the real source is identified, it can be addressed. I've worked with patients who were taking high-dose garlic supplements every day because they believed it was protecting their heart and lungs, and some of them were experiencing exactly this pattern. When we reduced garlic to culinary amounts, 2 or 3 cloves a few times a week, cooked, and discontinued the supplements entirely, several experienced measurable improvements in breathing comfort within 6 to 8 weeks. The fix: keep garlic as a culinary ingredient in moderate amounts. Do not take high-dose garlic supplements, especially if you are on any blood-thinning medication. Always tell your doctor if you are using garlic supplements regularly. Cooked garlic has significantly reduced allicin activity compared to raw, concentrated garlic. Cooking it doesn't eliminate the benefit. It simply removes the overcorrection. Now let me give you the other side of this, because I promised you this video would be balanced. If there are 4 vegetables to moderate, there are also 4 that I recommend actively building into your diet after 60 for genuine lung protection. Carrots, rich in beta-carotene, which converts to vitamin A in the body. Vitamin A is essential for maintaining the integrity of the lung lining, the protective barrier that keeps irritants out of lung tissue. Lightly steamed carrots daily are one of the simplest things you can do for respiratory health. Beets. Beets are rich in natural nitrates, the beneficial kind that convert to nitric oxide in the body. Nitric oxide dilates the blood vessels in the lungs, improves oxygen delivery, and has been shown in research to improve exercise capacity and breathing efficiency in adults over 60. 2 to 3 servings per week, roasted or steamed, is all you need. Zucchini and cucumber. low in oxalate, low in goitrogens, low in alkaloids, gentle on the respiratory system, rich in water and anti-inflammatory compounds. These are the vegetables I call safe daily staples after 60. You can eat them every day without the complications I've described. Sweet potatoes, rich in beta-carotene, vitamin C, and potassium in a form the aging kidney handles well. They support immune function in the lungs without the oxalate load of spinach or the sulforaphane overload of daily cruciferous vegetables. These four, rotated consistently, give your lungs what they need without the compounding irritation I've described today. Let me bring everything together now. The four vegetables to moderate after 60 for lung health. Spinach in large raw quantities. High oxalate load that deposits in lung tissue and triggers inflammation. Solution: cook it, rotate it, reduce daily large portions. Cruciferous vegetables in excess. Suppress thyroid function and slow mucus clearance in the airways. Solution: 3 to 4 servings per week, always cooked. Tomatoes and nightshades trigger immune response in the respiratory mucous membranes. Solution: cooked with olive oil, not raw in large daily amounts. 3-week elimination trial if you have chronic cough. High-dose garlic. Blood-thinning compounds create microbleed risk in lung capillaries. Solution: culinary amounts only, cooked, no concentrated supplements if you're on any blood thinner. And the 4 to actively include: carrots, beets, zucchini, and sweet potatoes. Now here's what I want you to expect if you make these adjustments. In the first week, you may not notice dramatic changes. You are removing sources of low-grade irritation. Give your respiratory tissue time to calm down. By the second week, many patients report that the morning congestion is lighter. The habitual clearing of the throat happens less often. Breathing during light exercise feels slightly more comfortable. By the end of the first month, the difference becomes more consistent. The improvement is quiet, gradual, the way damage was done, the way it heals. This is not a cure for any respiratory condition. What it is the removal of a consistent daily irritation that was working against your lungs while you thought you were protecting them. I want to close with something important. Your lungs have been working for you every single minute of every single day for your entire life, without asking for anything, without resting, without stopping. And they respond to what you give them. The information I've shared today is not about fear. It's not about eating less. It's about eating more specifically, in a way that actually matches the body you're living in right now. After 60, that matching matters. The body is more sensitive, not less. And small, consistent adjustments produce real, measurable improvements over time. Your lungs are not beyond recovery. Inflammation responds to what you remove from its daily fuel. Give them what they need. Stop giving them what quietly works against them. That's within your reach. Starting with your next meal. Which of these 4 vegetables surprised you most? Leave it in the comments. I read everyone. And if someone you know is over 60 and struggling with unexplained breathlessness or chronic cough, please share this video. That one share might be the conversation that changes something for them. Subscribe if you haven't already, because every week I bring you the kind of honest, specific information that rarely makes it out of the medical literature and into the hands of the people who need it most. Take care of those lungs. They've earned your attention. Everything in this video is general medical information based on published research and clinical experience. It is not a substitute for your personal medical care. Please speak with your own physician before making significant changes to your diet, especially if you are managing an existing respiratory or thyroid condition.